Hello, I'm Cheyenne, and today I will be discussing postpartum depression and wellness. Society plays a large role in the health and wellness of an individual. In the eyes of society, those who are smaller are seen as more beautiful than those who are larger. Individuals with mental illnesses are seen as crazy and as a possible threat to those around them. Both individuals who are overweight and those with mental illness lack support they need to get help and cope with their illness. This support can come from many places. This includes family, friends, and even the individual's community. These individuals may be too embarrassed to ask for help or to seek treatment. They may be discriminated against because they are obese or mentally unwell. The discrimination is in areas such as their workplace or a place of potential employment, in social events, and in medical settings. Employers may feel they would need to make special accommodations for these individuals. Individuals within the community may make fun of those who are obese or have a mental illness. They may call them names or make rude remarks. These remarks can cause the sufferer to be more embarrassed and to not want to come out of their homes. The seclusion could cause a loss of employment and friends. These individuals also face many barriers, such as being able to ride planes, having certain medical procedures done, and choices of affordable clothing. There are very high rates of obesity and undiagnosed mental illnesses. These are topics that are not openly talked about often in society. This leads individuals to question who they can turn to for help. They may not want to admit their illness out of fear of embarrassment. Exercise is the cure for everything. Not really, but it is the top recommendation for obese individuals. Exercise can help, but it's in combination with other life changes such as diet. Exercise can also help individuals with mental illnesses by increasing the production of certain hormones. Healthcare staff should approach these individuals with respect and sensitivity. The staff should understand that seeking help may be very difficult for the sufferer. Recommendations to eat healthier can go for all individuals, but those who are obese are not always that way because of their food choices. There can be many underlying issues. Today, there are many different resources available to help get individuals moving and to help them stay healthy. Fitness trackers, such as Fitbit, track steps and sleep. They easily sync to devices for the user to see their progress. MyFitnessPal allows the user to track their input and exercise. By seeing the value of their choices, the user can make changes. Game consoles are also coming up with games that are interactive. Wii games, Xbox Connect, and many others. These get the individual up and moving instead of remaining sedentary. Postpartum depression was first recognized in the 1950s. This is a severe depression that sets in after giving birth. The onset can be anywhere from a few weeks after birth up to a year. When first recognized, the treatment was electrotherapy. Now, treatment depends on how severe the depression is. There is counseling, exercise, and medications. Postpartum depression affects new mothers. All 8 dimensions are affected. All 8 dimensions of wellness are connected, and each one influences the other. Having poor mental wellness can cause poor physical or financial wellness. All aspects of daily living is affected by the 8 dimensions. Postpartum depression, like many other mental illnesses, can cause barriers for the individual. These are barriers such as properly caring for themselves or their family. They also withdraw from social events. Approximately 950,000 women suffer from postpartum depression. If left untreated, this depression can become fatal for the mother or child. In the future, there will be more education available. By providing education, women will know the symptoms and will be able to seek help sooner. More education and more women coming forward to speak about their experience will help to break the stigma that surrounds this illness. This will help others who are suffering to be less embarrassed to seek help. Specific treatments can help the sufferer cope with their illness better. Working together, the patient and physician can come up with the perfect plan of treatment. This can be medication and/or physical activity. Having more funding available to resources such as WIC gives more access to individuals with postpartum depression. And allotting more time during appointments can ensure the patient gets a treatment plan that fits them. Taking time during OB appointments, pediatric appointments, WIC appointments will help the patient know whether they should seek help. By evaluating for up to 12 months after birth, the symptoms can be spotted and treatment started sooner. All expecting mothers should be educated on the symptoms of postpartum depression and where to seek treatment before they leave the hospital. New mothers should be educated through classes provided through resources such as WIC or the hospital. Education materials should be available at numerous places such as the OBGYN office, pediatric office, WIC office, and the hospital. Being in areas that are frequented by those who may be affected by postpartum depression will help them learn the symptoms and give them the chance to seek help while at that facility. The biggest benefit of early detection of postpartum depression is a happy and healthy mother who can adequately care for herself and her family.